I'm Connor Armstrong. I'm one of the adult reconstruction surgeons at South Texas Bone and Joint doing hip and knee replacement, and we're here at our Bay Area clinic off SPID. I see a lot of patients who have pain after knee replacement, whether that was normally done by someone else and they come in for a second opinion. I happily see patients that have pain after their primary, and it's very common. And I work them up like I would work up any patient. I show them their x-rays and go over all the different possibilities for why they could be having pain after knee replacement. I see a lot of patients who have fractures, whether that's upper extremity or lower extremity. I'm happy to take care of those patients. Normally they come through the ER and either they see me in clinic or they see me in the emergency room because the hospital calls for a lot of those types of injuries. My subspecialty is hip and knee replacement. I see a lot of complex patients and complex situations, whether that's patients who have had hip or knee replacements or whether that's patients who have interesting or complex deformity. I see a lot of those patients just because a lot of the other surgeons in the community might not necessarily feel comfortable taking care of those patients. So luckily in fellowship I got the opportunity to use pretty much all of the different implants and implant companies, and I think there are certain situations where a different implant might be better for a certain individual, and luckily I have the expertise of using all the different implant systems out there. So I use the robot for every total knee replacement as well as partial knee replacements. It allows me to fine-tune the implant position. I can make half-degree changes or half-millimeter changes that I can't do by hand. I want patients to know just that I'll spend a lot of time with them in clinic. I won't cut them short. I like printing off pictures of their x-rays and showing them exactly what their problem is and what's going on. I also want people to know that I consider myself a conservative orthopedic surgeon, so I'm not trying to push anyone towards surgery who doesn't want it. I like to think of surgery as more of a last resort. I like performing all the conservative treatment options I can, whether that's injections or therapy, before jumping into a hip or knee replacement. I plan on being here for my entire career, so I think one of the benefits there is I'll be with you from start to finish. If you ever have a problem with your knee replacement, I'll still be around. My wife and I love the Coastal Bend community, and we plan on laying down roots here and being here for the long term.